Hi, this is Dr. Janowski for Sonata Laser Aesthetics. I'm talking to you today about total facial rejuvenation with fillers. Of course, there are other things besides fillers that can be used for rejuvenation, but I find fillers to be the most effective, most bang for the buck type procedure because we see immediate improvements with fillers, long-lasting effects, a year or more in most cases. And remember, what we're treating here is volume loss, and this is a problem that almost everybody has as we age. We lose volume in various parts of the face, and fillers are the best volume replacement products that we have. They give instant youth and filling to the face, and people are very, very satisfied with it. So we're going to use fillers today in a number of different areas. I can show you here on our model, Doreen, some of the areas we're going to consider. So one of the most important areas is the mid-face. What we want is we want to create more height and lift because this tends to fall and flatten with time. It will also have a pulling effect. It can actually even help areas distant from the site like jowls. We're going to put some in the nasolabial folds, help with some of the lip lines, a little bit of lip volume and definition, corners of the mouth and the marionette lines because these age the face quite a bit. We're also going to add some under the eyes in the tear troughs and then add a little bit in the Botox area, but instead of Botox we're going to put some filler in here. So there's many different areas and ways we can use these products, and we'll demonstrate that on Doreen today. So I like to use micro cannulas. These are needle-like flexible rods that are not sharp at the tip. That way we don't cause bruising. So I create a tiny needle poke with a regular needle, and then I thread the micro cannula through that hole, and by doing that the patient doesn't feel very much, and we inject it very non-traumatically, and we have the cannula in place here, and I'm injecting. Any discomfort there, Doreen?
None.
None, yeah. So it's really gentle for the patient, and they really appreciate not feeling needles and not having bruises. So we're doing a tear trough injection. This is under the eyes where everything gets a little bit hollow and it makes the eyes look dark and tired, and it's hard to cover with makeup. So when we fill that area, it's very, very satisfying. We can see a little bit of the darkness from the tear trough volume loss, and I like to use Bellatero with a cannula, again, avoiding bruising. It's a very easy injection. The patient hardly feels it, and we get an instant brightening there. So we're going to go ahead and start with our cannula here. A little bit of a wiggle. Okay, now we're in there. So we move that cannula right into position at the corner of the eye, and we're just injecting gently as we move away. And often just a small amount of product makes a big difference, brightens that area up. Alright, good.